Dr. Bebet here. Let's do our medical term of the day. And today I want to talk about plantar fasciitis. Plantar fasciitis is a problem with your feet, and it's a very common problem. It is due to the inflammation of something called the plantar fascia. And the plantar fascia is a thick band of tissue that runs from the point of your heel to the base of your toes. And its job is to support the bottom structures of your feet. People, for certain reasons, can get micro tears in that fascia, and then the tears get inflamed, and that produces pain. It can be brought about by several things. Overuse injuries is probably the most, and it would probably be mostly overuse injuries with improper footwear. People that don't have enough arch support in their footwear, people that have too much arch support in their footwear, those kinds of things. It can also be caused by overly tight calf muscles and anything else putting stress pressure on the bottom of the foot. Now, a lot of people come in and say they have a heel spur. Well, yeah, maybe you do. But the heel spur is not your problem. The heel spur is a symptom of the overall inflammation of the problem. It's the body's attempt to relieve the actual pressure. So treatment for plantar fasciitis is difficult, and it can take a long time. It can take up to a year. One of the things I recommend you do is get a bottle of water, freeze it, and then sit there with it on the ground and roll the bottom of your foot over that round ice barrel. That'll cut down the inflammation and help break things up. Plantar fasciitis pain is worse when you walk. It's worse when you first stand up. It'll actually get better, and then you sit down and rest. Everything tightens up. You stand up and tear it again, and there goes your pain problem again. So part of the treatment is to get it to heal in an extended position. So you buy appropriate orthotics that go in your shoes. You may end up having to have physical therapy. You may end up having to sleep in splints or casts that keep your feet in the extended position, or upward position like this. The very, very last thing you would want to ever have anybody do is operate on your feet to relieve this pressure. That is just an absolute, let's not do that unless we absolute have to thing. Sometimes you can go in and do an injection of corticosteroids into it. I don't do those. I'm not comfortable enough. It's like hitting a needle in a haystack, throwing that needle in blind. And I'd just rather somebody that does it all the time do it. So there you have our term of the day, a chronic common problem called plantar fasciitis.